Okay, and we'll get started. Good afternoon, everybody, and welcome to today's CIPD Coronavirus webinar on health and safety, which is part of our Returning to Workplace series. I hope you're all well. My name is Daphne Dooley-Green. I'm the head of CIPD Northern England and delighted to be hosting this session for you today. And it's great to see so many of you joining. I know you're still joining, so hopefully you'll get into the session and we'll continue to provide a great webinar for you today. So the coronavirus webinar series is one of the ways in which we're supporting people, professions to navigate the business change that coronavirus has given us. In today's session, we will be exploring what employers need to do as they consider a safe return to the workplace. And we've got three great speakers today who will share their insights and guidance on what you need to consider as we plan the roadmap ahead. Our panel of experts include Rachel Suff, who's the Senior Employee Relations Advisor at CIPD, Duncan Spencer, Head of Advice and Practice at the Institute of Occupational Safety and Health, and Andrew Willis, Head of Legal at Croner. I'm going to cover off some housekeeping and then we'll get on with the session. So this session has been recorded and will be available on demand via our webinar section of the CIPD website. You can access all of the previous webinar recordings there and also sign up for the future ones. We have a great session on Thursday, the 22nd of April on hybrid working and workforce planning. And then on Thursday, the 29th of April, we'll be hosting a session on rebuilding trust as part of this series. You will be muted throughout the session, and to submit questions to the panel, please can I ask you to use the Q&A function, not the chat function. The chat function is there for you to network with other fellow attendees, but if you could use the Q&A, that would be great. And just a quick reminder of all the great CIPD resources that we have available. We are constantly updating our FAQs and resources on our website all the time with the latest information and guidance for you. So please use the CIPD Coronavirus Hub to get the latest resources for CIPD members. We also have an individual legal advice line for members, so you can call our HR Inform helpline, and it's available 24/7. And then finally, CIPD members in the UK and Ireland also have access to the new Wellbeing Hub and helpline. And together with an award-winning workplace wellbeing provider, Health Assured, we are now providing CIPD members with a free help and support line 24/7, 365 days a year, providing telephone and online consultation with qualified therapists. So members can access all of that information via the member benefits web pages. And you'll see more of that at the end of the session. So let's get on with the session. Throughout February and March, UK government set out respective roadmaps to begin a gradual easing of lockdown restrictions in the UK. But as we know, any timetable or rules set out right now are still subject to review. But we do know that many in our profession and employers are now having to think about how they navigate a safe return to the physical workplaces. So whether that's about consultation, about risk assessments, around the legal implications, we have a panel of experts here today who can discuss and debate this with you and ensure that we help you plan out a safe return to work. So the running order today is Rachel will start and she'll provide the context from a CIPD perspective. We've then got Duncan and then Andrew, and then we'll open up for questions. So they each will present and then we'll have some time for questions at the end. So as a reminder, please use the Q&A function and I will try and get through as many of those as possible. So I'm going to hand over to Rachel to kick the session off. Thank you, Rachel.
Thanks, Daphne, and hello everyone. Thanks for joining. So it's a full year since we saw that huge shift to home working for many people a year ago that happened almost overnight with that first lockdown. And it's so uplifting to see COVID infection rates come down in most areas in the UK and the success of the rollout of the vaccination programme. If you remember, a few months ago, we didn't even know that we could have an effective vaccine to protect people from COVID-19. Next slide, please. And as Daphne said, a few weeks ago, the Prime Minister unveiled the roadmap for England in terms of easing the restrictions and the other devolved administrations are doing the same. In its accompanying guidance, the government makes clear that vaccines are at the heart of its strategy to managing COVID-19, and that also longer term, the narrative is very much one of transitioning from pandemic to endemic, meaning that hopefully longer term, the virus will reach a stable and manageable level. But it's really important to note that we're not at that point yet. And in terms of planning for a safe return to offices and other physical workplaces, there's still a lot of uncertainty. So organisations still need to tread very cautiously. As we move through those next phases of easing, what are some of the key issues that HR and organisations should be planning for? Well, the first bullet point, first and foremost, it's crucial that organisations really closely follow all the government advice as it changes and in its detail as well. At the moment, the guidance is very much to advise people to work from home wherever possible until at least the 21st of June. The 21st of June is the date of the last of the 4 steps that are set out in the government's roadmap in England. Now, before that step, the government is taking out a number of reviews to help inform what happens at that stage. There's one review on COVID status certification, and there's another one on social distancing. And that will be important in terms of informing organisations how they should manage that plan for reopening workplaces. It will inform decisions on current control measures like the 1 metre plus rule, face masks. It will also inform update guidance on working from home. But at the moment, people should still be working from home wherever possible until that review is complete. At that time as well, the government will also update its COVID secure working guidelines, and I've got a copy of those at the bottom, working safely during coronavirus. But obviously, the paramount principle, and I know everybody in this audience will be following this, and that is that people's health, safety and well-being continues to be absolute priority. And the second bullet, I've said that government is placing vaccines at the heart of how we handle COVID going forward. And in the wider sense, that's a longer term, that's undoubtedly true for society and for workplaces as well. But in the here and now, as we plan and manage a safe return to a physical workplace, there are a lot of factors to take on board, and it is important that it's holistic. And an organisation's plan shouldn't hinge on vaccination. I mean, the data so far on vaccination, it's really encouraging in terms of protecting people from serious illness and so on. I'm not going to go into detail on all the issues around vaccination, but we still need more data in a lot of different areas on the impact of vaccination on the whole population. We're nowhere near anything like herd immunity. And certainly by June, all adults will by July offer the first dose, but it'll be some time before the second dose. We still know that some will be unable to have the vaccine or will be unwilling. And also we don't know how long immunity lasts. So there's very good reasons why the government says it's going to be led by data and not by dates in terms of easing restrictions. And that regardless, even after every adult has been offered a vaccination, there will still possibly be the need for some measures to carry on to keep people safe. So on the third point, an important message from the CIPD and from others as well is that in terms of planning how you approach a return to a physical workplace, in terms of health and safety, do take a holistic approach and do still have a lot of regard for your COVID secure risk assessment. There are a lot of moving parts to this jigsaw. And on the one hand, it's great that we've got the vaccination, of course, and also expanded workplace asymptomatic testing, but these are more factors to take on board, so it's no less complex to navigate in that sense. And also the government says that when it does update its COVID secure guidelines, it will also take on board and issue new guidance around how organisations should, for example, improve fresh airflow. Ventilation is very important to help reduce transmission, so there'll be that guidance to take on board. And also, I've mentioned the expansion of the availability to businesses of mass rapid workplace testing for asymptomatic situations, and the government sees that as an essential pillar of returning to workplaces as well. I mean, at the moment, they're offering free home workplace kits, lateral flow ones, and they're encouraging any organisation with at least 10 employees to register by the 12th of April, even if your workplace isn't actually open yet. That's in England. So a lot of things to take on board. Next slide, please. So given that, as far as the CIPD is concerned, our 3 key tests for a safe return to a workplace still apply. Any return at the moment, as you plan it over the weeks, months ahead, should be essential based on current government guidance at the moment, should also be planned, gradual, safe, of course, and mutually agreed. And I just want to focus on the last bullet here, the last part of that framework. Is it mutually agreed? Because what we mean by that is that it's really important that there is a dialogue between the organisation, how it's planning, and how every individual feels about that return to a workplace, so that any concerns, worries, changes in circumstances and so on, and expectations can be discussed as honestly and supportively as possible. And I think regardless of what the political narrative is at the time in terms of a return to offices, for organisations, it's a balanced approach that's needed, and taking on board people's individual needs and preferences where possible, whilst obviously satisfying the needs of the business as well. Because we've been carrying out research really regularly at the CIPD on employees, how they feel, how they've been impacted by COVID, what are their attitudes about a return to work. And as you'd expect, we've had a very mixed bag of responses. Some people can't wait to get back to the office and all that human interaction. On the other hand, it's been a whole year for many people. Many will have experienced all sorts of challenges, as we know, in that time. And some people's mental health has been compromised. And we did find a significant level of anxiety about a return to a workplace on the part of some people, especially where there was a significant pre-existing health condition. So also, just on a more general level, if you think for the past year, we've been told to stay at home, stay safe, people's perceptions of risk and what's safe could really have changed during that time as well. So it's really important that people have an opportunity to talk about how they feel about a return to a workplace. And then next slide. Just to help guide you through some of these issues when you're planning a safe return to the workplace, we've got here on our website a return to work planner, and it's like a flow chart, and it's based on those 3 tests, and we'll be updating it all the time in line with government guidance. So do have a look at that. It's free to download from our website. At the CIPD, we've very much been consulting our own workforce as soon as we could, really, about how people feel about how they'd like to work in the future, how do they feel about returning to the office. And we're very much encouraging our own ways of working to become more hybrid, so that we can meet people's needs and encourage a safer return as well, because having a hybrid way of working can encourage less people into the office at one time. So it's a really good interim approach to have in terms of health and safety. Also, what's your longer term vision? How can we make the most of the advantages for many people of home working? Today we published research that finds that employers, the number of employers finding that productivity amongst home workers has gone up over the past year. So there are many advantages for the organisation and for individuals as well from encouraging more flexible ways of working. So how does that fit into your longer term vision? But the sooner you consult and communicate with people about what your plans are, the better. And then next slide, please, thanks. Finally, I want to just say something quickly about the role of line managers, because they need to be supported as they help and support people to transition back into a workplace in a way that recognises people's personal challenges and concerns. They're very likely to be the first port of call for people. So their role, it's always been important, but it's even more important at the moment. We have a number of new starters at the CIPD, and I'm sure every organisation will have had new joiners who have never been into the office, so they will definitely need an induction. There'll be many people who've been on furlough, but I think we can all benefit from some kind of reinduction process as part of a return to the workplace. And being able to show empathy and listen and also give adjustments to people who might need them is also an important part of the line manager's role. I think the demands on line managers at the moment are extensive. Obviously, they've got their operational role as well to fulfill, and they could be dealing with some quite complex situations personally amongst those in their team. So they really need the ongoing support of HR and know what your plans are and where the support is that they can offer people and access themselves as well in terms of their own well-being. Next slide, please. So final slide. I've only really been able to give a very brief overview and scratch the surface of what your organisation will be considering, and I'm sure you've already been considering some of these issues as part of your plans for a return to a physical workplace. Duncan and Andrew are going to cover some of these issues and more in more depth. But I would say I think it's really valuable to have forums like this and others as well, where you can share and learn from experiences, because I think we'll all be learning as we go along as well. Also be very ready to adapt your plans very quickly and follow that government official advice as closely as you can. We've all been changing our plans very rapidly over the past year, including at the CIPD, and I think we've all become stronger and more agile because of it. So I mean that's a positive. We've got lots of really helpful guides and practical issues dealing in depth with all of the issues that are going to be discussed on this webinar today. So do visit our website. I'll leave it there. Thanks.
Well, good afternoon, everybody. This is a very important subject and obviously a vast one. So being a speaker with only 10 minutes or so with a lot of ground to cover, I hope you forgive me that I'm going to give you a selection of fact as well as some signposts to where you can get lots more information as well. So hopefully you'll find that helpful. So next slide, please, Christian. So coronavirus then, are we near the end? Well, I don't think so. While the UK has advanced in its vaccination programme, that is not the case for the rest of the world. That gives the opportunity for COVID to pass over geographical boundaries and for new variants to develop that may even negate our vaccination efforts. It is therefore conceivable that workplace precautions to prevent transmission may have to remain in place for some considerable time yet. Organisations will need to continue to adjust how they work in line with rules, advice and guidelines from government. Next slide, please. IOSH has been working in collaboration with the World Health Organization and other partners to provide a webinar series on how to manage COVID. So far, there have been over 20,000 delegates who have attended, and the popularity of the IOSH resources subsequently developed is indicated by more than 230,000 visits to our web pages containing our free material, which I'll indicate during this presentation. During the last 12 months, IOSH has created a knowledge hub, www.iosh.com/coronavirus, that continues to grow as the pandemic responds to changes. This helps with guidance on workplace hygiene, preventative measures and such like. We've also supported managers and staff with adapting to deliver good remote working management advice based in part from our previous IOSH funded research, as well as the ergonomics of home working, you know, around workstations at home and that sort of thing, and working from home mental health as well. I'll come back to that later. We have also initiated a return to work safely campaign, which started last summer. And we're offering advice on all aspects covering how to prevent infection spreading, how to make all work COVID secure, and looking after people and their well-being, including mental health and wellness. More recently, we've joined forces with the World Health Organization to develop a free course on managing coronavirus risk. That includes a module on returning to the workplace safely, and there's a link to it on this website that's shown on this page. IOSH's online coronavirus advice hub and its resources helps people navigate a safe path, effectively managing the risk with guidance in our 4 areas of safe people, safe workplace, safe equipment, and safe systems. So let's look at those in turn. So next slide, please. Safe people. What do we advise you to do around safe people? Well, our advice includes assess the COVID-19 related risks and protect all workers, including the vulnerable. Keep records on shielding, isolation, and the vaccination of employees. We suggest that you only those workers who can't work from home return to the office first. Because, you know, in actual fact, many people are saying, I want to stay working from home. I'm one of them, you know, and so there is a consideration I'm sure that you've been discussing in your different businesses. Provide adequate training, consultation, communication and awareness with a means for workers to raise concerns. Rachel's already touched upon this, but communication is highly important and very difficult at the moment when you're having to work across media like this. Most importantly, myth bust false coronavirus information. You know, the social media out there is guilty of driving many falsehoods, you know, like falsehoods around vaccination, for example. So it's really important that we all work together to keep tabs on what is fact and what is not. And of course, you need to support the ergonomics and well-being of home workers. Next slide, please. So next, look at the safe workplace. So we advise you that you need to keep the physical distancing still. And that means that you'll have to think about signage and distance marking, barriers, one-way systems, reduction in numbers in working environments. Maybe think very carefully about A and B shifts or even different shift separations and trying to manage handovers and that sort of thing between shifts. Secondly, improve hygiene. Washing facilities, hand sanitizers, regular surface cleaning, tissues and disposal services, increased cleaning frequencies, you know, those kinds of things. Support appropriate use of face coverings for reducing the spread to others, but do explain its limitations because there's a lot of misunderstanding about that. Improve ventilation arrangements. That's a real key thing that we're hearing from government at the moment. Redesign processes to reduce risks, including, for example, retaining teleworking. And finally, don't forget that your fire alarm and your fire emergency procedures, because that will often channel people in different places and often to a congregation site, and that might be against the rules. So you might need to review those things. Next slide, please. Safe equipment. On equipment, we suggest, first of all, you provide any personal protective equipment and ensure that people are educated now to use it safely. That is a requirement of British law, by the way. Check your heating, ventilation, lighting, and hygiene arrangements. Be careful of shared equipment such as hot desks, work vehicles, machinery, and consider how they will be cleaned in between the use by different employees, because remember, the virus can be transmitted via contaminated surfaces. And on the return to the workplace, ensure safe recommissioning of plant and equipment and statutory inspections. You know, if your office building or workshops have been shut down for a period, then it might mean that you know, things have started to leak or fail or whatever. So you've got to make sure that you get up and running in the best and safest way possible. Next slide, please, Christian. So on to safe systems. So with regard to safe systems, review, update and communicate all safety risk assessments in the light of COVID-19. So this is really important. You know, it's not just about COVID risk. When people come back into the workplace, they're going to be exposed to all the normal workplace risks they were exposed to before we had a lockdown. So don't lose sight of those things, and don't lose sight of the fact that you might have to review those assessments because the different COVID arrangements might change the activity in a way which actually increases risk. So review those things. Secondly, ensure workers who are symptomatic know they shouldn't be at work, and anyone who develops symptoms is isolated and sent home. Employee testing. This is quite complex, and I would suggest you seek further information and advice if you're going to do that. Think about staggered starts to shifts, you know, so and when they're going to finish, and maybe staggered break times and the use of break areas, rest areas, those kinds of things. When returning to work, buildings, check fire safety, first aid provision. Don't forget your water systems and the Legionella risk, and asbestos management arrangements and statutory inspection requirements. And remember that COVID-19, as I say, is just one of the safety risks in your portfolio. So don't lose sight of all the other things that you still need to make sure are in place. Next slide, please, Christian. So encouraging buy-in, as always, and I'm talking to a HR audience, so you'll know this, but managers are absolutely the key here. Good safety is delivered by good management. So we've got to focus on how we help our managers. In actual fact, IOSH recently collaborated with the World Travel and Tourism Council produce a new free guide to help managers. I know that this guide you see here, From Protocols to a Safety Culture, was designed for the travel industry, but actually, do you know what? It's applicable to any industry. So it's available for free, and it can be downloaded. It has two main sections. The first section being acknowledging common pitfalls. So line management ownership, communication, ensuring the plan is fully supported, the importance of inclusion, encouraging empowerment and autonomy, catering for a transient organization, and being a listening organization are included in that section. And secondly, a manager's toolkit, including much more on risk assessment. How do you read it? How do you use it? Infection controls. Why do we have them? What if they're not working? What if we think of new controls? What if contractors are working to a different standard? What if the conditions change? How do I deal with a COVID incident? All of those things are included within this guide. So if you follow the web address given, what you'll find is you'll have to scroll down to the bottom of the page, and it's over on the right hand side, but clearly it has the same motif as is shown on this particular slide. Next slide, please. So what else can we do? Well, we do need to think about workforce well-being and mental health. Think about the person. You know, some might have lost loved ones. They may have failed to cope with lockdown. They may have loneliness from the isolation of it. There may be stress at home with homeschooling, worrying about the family, worrying about their job security. All of these things have paid a toll on many people. And whether people have been on furlough or not, employees may well be apprehensive about returning to the workplace. They're worried about their safety, worried about whether they can remember how to do their jobs even, worried about their futures. It is likely that there will be a spike of need, therefore, for mental health support. So you need to review your systems, such as your employment advisory programs, your EAPs, and if you have them, your mental health first aid provision and other mental health provision that you have in place, because it might be when you introduce people back into the workplace, there will be a spike of demand for these systems. So can you deal with those things? What do you need to do to prepare your management teams? You know, management will need to adapt their style to accommodate this potential employee mental fragility, if I can put it that way. They need to consider how they communicate, being honest and transparent to rebuild trust, how they will build regular contact with every employee, what boundaries need to be set, how they can encourage employees to talk, actively looking for opportunity to promote positivity and motivating through praise is absolutely crucial during this period as we rebuild people's confidence in the workplace. Next slide, please. So many people have been introspective during lockdown too, remember, and some have resolved to look after their health much better. So there's probably going to be a demand in this area. So organisations can help by offering general well-being information, encouraging healthy sleeping, make sure that people have regular breaks from their work, socially distanced physical activity, eating nutritious food, encouraging workers to participate in perhaps things like controlled breathing exercises, you know, centering and being in the moment and those kinds of things, encouraging good standards of hygiene. You know, all of these things help to build a person's resilience, not only to the disease, you know, but to what life is presently throwing at them. Next slide, please. So recovering safely. So in summary, IASH has a dedicated web page for returning safely, and anyone can access it at www.iash.com/returning safely. It focuses now on making work COVID secure so far as reasonably practicable. We advocate competent, thorough risk assessment as a starting point, but remember, a risk assessment doesn't control the risk. It's what people do that controls risk. But it is a starting point when determining how people can work in a COVID secure and healthy way, either in their customary workplaces or wherever they might need to work remotely. The risk assessment model you can download for free from IOSH may be applicable to any workplace. It's general questions which enable you to find your own answers. And you can also find further information by visiting our main coronavirus page, by viewing our COVID webinar recordings, which are freely available, checking out IOSH's Connect eShot, which has lots of other news on webinars and advice and guidance, reading the IOSH magazine, there's lots of in-depth analysis in that. And then we do have our own online events across our networks as well. So our branches and groups are doing are having those available. So I've put a few of those websites down for you, but they've all got links to one another, so you'll be able to find your way around them. And final slide, please. So that's it from me. Thank you very much. I'll be available for the panel in a minute. I'll hand over to Andrew. Thank you.
Many thanks, Duncan. And I'm head of legal at HR Inform, so I'll be picking up some of the legal issues that may well arise on a return to the workplace. So first slide, please, Christian. Many thanks. So we look first at how we arrange the return of employees, whether we do that all at once, whether we stagger it. What sort of issues should you be considering in order to avoid employees flooding back to the office in one go? And all the issues that may present in terms of distancing and general safety. Well, really, the factors to bear in mind when deciding who comes back and when are, number one, the safety of all employees in the light of continuing social distancing requirements, and the needs of your business. Who do you need back first? Who can effectively carry on working from home? And who really needs to be back in the office once you're able to get the office back up and running. You could think about selecting employees by function. Perhaps you could stagger the return or have a rolling rota of people who may come into the office to get everyone used to coming back. You can also continue to make use of flexible furlough if you need to. If you don't need everybody back in one go, that scheme runs until the end of September. And it's as flexible as you need it to be now. So if you don't need people to be working their full hours, if you don't need people back at the office altogether, do make use of that scheme. It continues to run, as I say, until the end of September. The important thing to do when taking all these issues into account is just to have an eye on the risk of a discrimination claim. Make sure you have good objective reasons for selecting one person over another, one group ahead of another. And if you can, document your thought processes around that so that you're in a good position to defend any claims that might follow later. One thing that employers may be thinking about is only having back those people who can prove they've been vaccinated, and that raises issues, particularly around a risk of disability discrimination. So many people who can't have a jab will be people with conditions like cancer, the treatment for which can give rise to immunosuppression. So in imposing that obligation, that requirement on your staff, saying to them that you can only return if you've had a vaccine, essentially you are indirectly discriminating against anybody who can't have a vaccine, and that would include people with recognised disabilities. Now, it's perfectly possible to justify indirect discrimination in the right circumstances, and we know the government are thinking, for example, about insisting on care staff having jabs. But thinking ahead, it would be a lot easier if a case ever ended up in tribunal to justify imposing those kinds of conditions in a care setting than it would be in an office setting or even an outdoor setting, where really, provided you're continuing to follow social distancing and other safeguards, should mean you can manage the risk regardless of whether somebody's been vaccinated or not. So be careful around imposing those kind of conditions around vaccinations, and be clear on your thinking about why you're allowing certain people back over others. As I say, document those reasons. You might consider leaving clinically vulnerable people on furlough or are working at home for longer. We know that those people are not required to shield from this week, but they will still be very anxious about their conditions, and essentially they will still be at greater risk of serious illness if they're exposed to the virus. So it's a perfectly reasonable approach, again, to consider leaving them working at home or leaving them on furlough for that bit longer. But again, involve them. As the other speakers have stressed, do involve your employees, do talk to them, and again, document your thinking and decision making as you go, so that you're in a position to defend any claim that may arise later. Next slide, please. Again, communication is very, very important. Give people reasonable notice of their return to the office. Some of them will have other responsibilities, and it may not be possible for them to put other arrangements in place quickly. So, do talk to them and give them plenty of notice of when they may well be required to return. Consider writing to them formally, so you've got a record of the intended return date. And also, you can take the chance in that letter or any communication like that to outline the health and safety requirements that will apply in the office, because some people may not have been back in the office environment for several months. Things will have changed during their absence. You will be imposing new conditions. The environment will not be the same. So take the chance to communicate to them how things have changed and what you expect of them as employees to maintain that safe environment. And as well as doing that, of course, talk to them about their individual circumstances, not only around caring responsibilities, which I touched on just a moment ago, but also around any conditions that they may have as well. Remember that any changes to working conditions, be it a temporary flexible working arrangement that somebody may wish to agree with you, or perhaps continued working from home, or perhaps periods of unpaid leave if no other solution can be found, all of these things essentially amend terms and conditions of employment. So it's very, very important that you try to obtain your employee's agreement to them, again recorded in writing if at all possible, so that there can be no allegation later that you've tried to change terms and conditions, or that you've done so unilaterally and given rise to the risk of a constructive dismissal claim or a discrimination claim. So do work with your employers and discuss with them any changes that may apply to any of them, but particularly to those whose situation might be that bit different as a result of their own personal circumstances. Next slide, please. Of course, there will be some employees who, for whatever reason, are reluctant to return to work. Most of them, I imagine, will be concerned around the risks they might face in the workplace. Some are fairly relaxed about mixing with others. Other people aren't, especially those who have particular conditions. But anybody who's been isolating or working from home for some time may well feel anxious about coming back. So again, talk to them about the precautions that you're taking to reassure them that you're alive to the risks, or your company's alive to the risks they may face, and that appropriate steps have been taken to mitigate those risks. Do ensure compliance with health and safety rules. It's one thing to introduce changes to the environment and new rules around how people mix, but very, very important that they're implemented in a fair and understanding way, but implemented consistently nonetheless, because that will reassure people that the rules are being observed in spirit as well as in the paperwork. And if people do seem reluctant to return or even refuse to attend work without what seems to be a valid reason, do be careful about how you tackle that situation. If they have genuine concerns about the workplace and how that may pose a serious or imminent threat to them and to their safety, then they are entitled under law to leave the premises. And if they do that, they are entitled to be protected against dismissal or any detriment. In other words, if you dismiss somebody for going AWOL because in the face of a reasonable concern about their safety, they've left the premises, you could face an automatically unfair dismissal claim. And the important thing about that claim is that no service is required. General unfair dismissal claims require 2 years service. These automatically unfair dismissal claims don't. And the other thing to note about them is that the compensation limits for unfair dismissal do not apply to these types of automatically unfair dismissal. So you could be exposing the business to a significant risk if you do take disciplinary action or even dismiss somebody who is refusing to attend the workplace because they believe reasonably that the workplace poses a risk to them. Now, being proactive, talking to employees helps to reassure them and challenges that idea that the belief they're at risk may be reasonable. So do it for those reasons as well. Obviously, primarily do it because it's good practice and it promotes good workplace relations, but it also helps you as the employer to eliminate or minimize risk. So keep them involved, keep talking to them, and where you are meeting resistance, take time to understand the reasons and try to address those concerns. Next slide. Thank you, Christian. So this is just a very quick slide to remind you all of the employer's health and safety obligations. Duncan's been over this already, but basically any employer, all employers have an obligation to maintain the health, safety and welfare at work of all of their employees so far as is reasonably practicable. Now, in previous sessions, we've looked at vaccinations and testing, and certainly encouraging your staff to be vaccinated and implementing a workplace testing regime will help you in meeting those obligations, but also there'll be a need to take additional steps for the foreseeable future, not least because not everyone will ever be able to be vaccinated, and it'll be some time, well towards the end of the year, I would think, before everybody who can and who wants to have a vaccine has had it. So we'll look in the next couple of slides at what those additional measures might be. So this goes over some of the same ground that Duncan's already covered, but we'll just go over it briefly and discuss the legal issues arising. Do ask your employees as they enter the building each day whether they're experiencing symptoms. Consider temperature checks. Remember, though, that collecting this information gives rise to additional GDPR obligations. This is special category data. So the employer has to identify both a lawful basis under Article 6 of the GDPR and a separate condition for processing the data under Article 9. Data protection is a subject itself. You could do a whole webinar on that quite easily, so I won't go into further detail on that, but just be aware of that risk and that issue, and do involve your data protection officer in discussions about that. We've talked already about staggering working hours and alternating days. Remember, as I've already said, that those changes are potentially contractual changes. So do obtain your employer's agreement when making those sorts of amendments to terms and conditions, even if they're only on a temporary basis, to eliminate the risk of somebody claiming constructive dismissal. Next slide, Christian. So these are some of the physical changes that you might consider. And I won't go through them in any detail because Duncan's covered this already. But what I will say is, it's very, very important that you implement any measures like this in a consistent way. Heaven forbid you end up in the situation of having to dismiss somebody for not following these kinds of measures. One of the acid tests in an unfair dismissal claim is, did you act consistently? Did you treat all employees consistently? So it's very important, not only from a safety point of view, but also from a legal point of view in terms of employment law, to implement rules in the workplace consistently across employers and across groups of employees. And then final slide, Christian. In terms of the clinically extremely vulnerable, again, as I've said, many of those people will be disabled under the Equality Act, so you have a duty already to consider reasonable adjustments. Consider reallocating to another role, to another workplace. But remember, again, that doing that is essentially a change to terms, and you need agreement for all of those changes to keep yourself safe from potential breach of contract claims. And I think that's all I had to say on the slides, but obviously we'll turn over to questions now, Daphne.
Great, thank you, Andrew. Thank you, Rachel and Duncan. So much insight and information there. So thank you very much for your presentations. We have quite a few questions coming through. So some are quite similar, so I'll theme them, but a couple of quick questions that I think Duncan, you might be able to support on. There's one question here from Jordan around face coverings and whether they're compulsory or whether it's a company choice. You know, anybody may be able to answer that, but I know you covered that briefly in your presentation, Duncan.
Yes, thank you, Daphne. So, okay, so think of it this way, you know, instead of trying to look for absolutes all the time, you've really got to start from the point of view in your assessment of what is the context that I'm asking that question in. You know, because if you're asking that question about somebody who's, say, directing cars in a car park, then the wearing of a face mask is less important than if you're talking about somebody who's dealing with the public across a reception desk, for example. So you've got to really think about it from a risk point of view in terms of transmission, and think about the fact that, you know, the guidance is very clear in the UK: 2 meters distance, well ventilated environment, and so on. And if you've got those in place, then you're starting to win the battle. But personally, I feel that in terms of wearing face masks and such like, what you are doing is you are not only being courteous to other people, not only encouraging other people to be confident in when you're close to them, that you're not going to spread the disease to them. There's those kinds of factors as well that I think are really kind of important, the psychosocial factors, if you will, that are associated with this. But it's very, very clear, all the evidence shows that the wearing of a face mask helps to cut down the transmission from one human to another through the particulate matter within the breath significantly. So if that is appropriate in the context of your workplace, then you should be wearing face masks within it.
Thank you, Duncan. And some questions coming through actually about return to work on the 12th of April. So one question is, an employer is suggesting hybrid working from the 12th, and of course, naturally there's some pushback. around this from individuals who perhaps are not ready to go back into the workplace. I guess it's just, you know, what advice can we give to HR in those circumstances? And actually, there's quite a few questions coming through on the same topic, you know, where, you know, obviously keen to get back into the workplace, but equally we've got used to working from home. So therefore, you know, what can we do? What's that conversation, I guess, between people managers and individuals that helps with some of this challenging navigation? Rachel, any advice?
Yeah, I mean, thanks, Daphne. I mean, the 12th of April feels early to me, to be honest. The government guidance does say that the earliest is the 21st of June, and the sort of official advice, I know we've had the stay-at-home legal order lifted, so you wouldn't be breaking the law to go into the office. But at the same time, it is urging people, the government, to work from home until they have had a chance to, in England at least, review, to undertake several reviews, including one on social distancing. And that will inform measures around social distancing at work, face masks and other measures as well. So I would proceed more slowly.
Okay, thank you. And Andrew, do you have anything to add from a legal perspective?
Just to say again, really, that those people who do have those concerns, talk to them about them, find out what they are. There may be really good reasons, either around health or around their care and responsibilities, that make them reluctant to come back. I think, generally speaking, and I'm sure, you know, Duncan will comment on this as well, but generally speaking, it's probably a good idea to stagger returns and maybe rotate returns so that you can get people used to the new systems that are in place in the workplace, in a smaller working office-based population until everyone gets used to how it works. It'll be safer for everybody. So I think staggering is a good idea, but I think talking to people individually is really important to address any anxieties they have. Find solutions where you can, and there'll be some simple solutions, maybe about different working times, or around just resiting them in the office somewhere a bit more remote or near to a window so they feel assured that they've got good ventilation around them. Simple things can address a lot of those concerns. So have those individual conversations.
Great advice, thank you, Andrew and Rachel. So there's another question here from one of our attendees around if our return to work is not planned until June, as you've just mentioned, Rachel, should we be signing up for, and I think it's lateral flow by the end of April, as originally set out in the guidance. So I guess, you know, I think the kind of broad question is, there was original guidance and that organisations couldn't work from home. So I guess it's the same theme again, people not quite understanding the current guidance out there.
Yeah, I mean, it's hard to keep up with all that guidance, and it's constantly changing as well. And just around the workplace testing, the rapid lateral flow tests that the government in England is, and in the other administrations as well, is expanding all the time. That keeps changing because I've been looking at it over the last few weeks. But the latest advice from government, they're really urging companies, if you've got at least 10 employees, even if your workplace isn't open at the moment, to register by the 12th of April, although I imagine they might extend that deadline as well, because they're really keen and see the mass, regular, asymptomatic testing, and these are home test kits that they're offering to businesses free at the moment. I think, why wouldn't you sign up for it? Because it's just another measure that you can take to help keep people safe. So I would.
Yeah, thank you, Rachel. And a question for Duncan. Your presentation had lots of signposting of, you know, great resources. There's a question here from an organisation who potentially are small. They don't have a lot of resources, and trying to prioritise how they approach everything that we've been talking about. I guess it's, you know, what advice would you give to a smaller organisation who's trying to navigate this right now?
Very good question. It's a question actually that I ask frequently in my own organisation, because it's easy to work with large corporations, but there's a hell of a lot of small enterprises that we need to reach out to as well. I think the my previous advice on understanding your context is really key here. So what is it you're expecting people to do? How might they become in contact with other people? How might they actually come in contact with this virus? You know, so that leads you then to think about distancing, that leads you then to think about hand hygiene, that leads you to think about hygiene of surfaces within the working environment. It leads you to think about ventilation that's necessary, who's going to be in the workplace at any given time, so on and so forth. It's understanding your context and understanding how you can be flexible around it. You know, you don't have to be a coronavirus expert, and I wouldn't be overly worried about all of the information that's out there. You know, by all means go and look at it and read it and digest it and so on. But if you haven't got the time, purely and simply, if you think about what the government's saying in terms of hands, face, space, and you're thinking about that in the context of your working environment, you'll go a hell of a long way in terms of controlling the transmission of this virus. So try not to be overly worried, deal with what you can simply, and then build from that position would be my advice.
Thank you. And Rachel, Andrew, do you want to add anything to that?
I just think that's really sound advice. And I did say when I spoke that this is a complex picture, and it is in one sense, but at the same time, as Duncan says, the most effective measures to help control the virus and keep people safe are those basic risk sort of things that you have in your risk assessment, like good hygiene, the hand washing. So if you just take it step by step and follow that risk assessment, match it to your business, then it doesn't need to be overly complicated.
And from a legal point of view, certainly in the context of unfair dismissal, you know, an employer will be judged bearing in mind their size and administrative resources. So I think what the previous speakers have said is absolutely spot on. Start with first principles and do what you reasonably can as an organisation, obviously, and that will turn on your size and resources to a degree. But as long as you've taken reasonable steps to follow those basic principles and implement them, you should be okay.
Okay, thank you, Andrew. And just one last question before we close. There's a question around, are there any resources on consultation approaches? So I think it says employee surveys. I don't know whether that's an Andrew or a Rachel question, but any thoughts?
I think on our website, we've got a home working sort of questionnaire. We've got a return to work guide, a return to the workplace guide as well, that I think covers sort of how to communicate, consult. And I think on the HSE website as well, there's guidance on how to carry out that sort of consultation process collectively and individually. So there is good guidance out there, and I'm sure IOSH as well have got good tools.
Right. Okay, fantastic.
And there's also the HR Inform resource as well. You know, take individual advice as you need to. Yeah. That may, you know, this issue may arise most commonly at the moment in the context of redundancy. So as and when you reach those situations, do take advice.
Yeah, we've got our helpline, of course, which for members is such a valuable resource, because often it does fall down to those individual situations, which can be so tricky.
Absolutely.
I think this is one of the situations as well where small businesses are going to be far better than large businesses, because small businesses tend to feel like small family units. They tend to be much more open and can communicate much better together. So I think small businesses will be ahead of the game in that respect. The real challenge is in large complex organizations in making sure there's a consistent cascade of accurate information through all of the line management chain. You know, that's the real challenge here. But I think above all else, you know, just keep talking. You know, that's what humans are supposed to do, and we need to do more of it. And you can't do too much. Just try and understand one another and each other's perspectives, and educate each other from those perspectives.
Yeah, great advice. Thanks, Duncan. And I always try and commit to getting through as many questions as possible. So this is a very quick one, and I'm not sure whether we know the answer, but it's in relation to shielding. So can shielding be extended for extremely vulnerable employees? I don't know whether that's something that the employer decides or not, but I guess it's a question for you, Andrew, potentially.
Well, I mean, clinically extremely vulnerable people are no longer required to shield. That's been lifted from this week. But certainly when you're talking about a return to work for people, you have a responsibility as an employer to maintain their individual health and safety. So do talk to them about concerns they have, the risks they may be facing, and deal with those. And that may mean somebody working from home for longer or working in a different environment. Depends on the circumstances, but just because shielding has that requirement has gone away at a national level doesn't mean that individuals won't need to think about that as part of an overall strategy for avoiding risk or minimising risk.
Yeah, okay, that's great, Andrew. It's 12:30, oh sorry, even 1:30 now. So we'll end the session. I want to thank Duncan, Rachel and Andrew for all their contribution. It's been a fantastic session, and a reminder that all the slides and the recording will be available later. And of course, just to go on and check out all of the CIPD resources that I spoke about earlier. So thank you, have a lovely Easter and take care.
Bye.
Goodbye, everyone.
Goodbye.
Bye.
Bye.